Well, the availability of the vaccine getting a lot closer now, but there are still a lot of unknowns about the shot, who's going to get it, and the possible side effects.
Today we're joined by Dr. Kristen England. She is an infectious disease specialist at the Cleveland Clinic, and she's joining us to answer questions about this vaccine that is heading our way. First of all, thank you so much for joining us this morning. And I think the first question, maybe one of the top questions on people's mind, as Wayne just mentioned, are the side effects. What could we experience from this after taking it?
Well, good morning and happy Friday. We're all very excited about the potential availability of this vaccine, or these several vaccines that are coming up. As with any vaccine, though, there can be some mild side effects, and we're certainly hearing that coming out of the trials and after our first day of seeing what folks are going on in receiving it in the United Kingdom. So the main side effects that patients are seeing is that they've got soreness at that arm. For the next day or two, they may be having some mild flu-like symptoms with having some fatigue, maybe some fevers, but generally that's gone within a few days. So this may be a little bit more than you might be seeing with your regular flu vaccine, but certainly compared to what COVID-19 does to the body, this seems pretty mild.
Now, Pfizer's got the head start on actually releasing the vaccine. As you mentioned, it's already been released in places like England. But it's two shots, though, right? My question is, all right, can you get infected between shots?
So unfortunately, that's still a possibility. That's why you have to get the two shots, is that you get the first shot, it's not 100% effective. Thus, you need to get a booster shot. So there certainly is the possibility that someone can get infected in between those two shots. So it's so important that we continue masking, we continue social distancing and washing our hands. And even after you've received that second vaccine, it's so important to continue doing that as well. We don't know if you can get infected again, even if you've been vaccinated, but not show any symptoms, but still be able to pass the virus on without any symptoms to somebody else. So that's why it's so important we continue this whole masking, social distancing practice for the next many months.
Are there any groups of people that should not be getting this, or is this something that anyone could take? We've been hearing even maybe allergies could play a role. Are there any issues that someone might have that might make them not be in a group that would be good to have this vaccine?
No, correct. So far, the only people that we're seeing at this point in time came out of the information from the United Kingdom, and that's folks who have severe allergies to whether it be medicines or foods. Somebody that has an allergy that requires that they carry around something called an EpiPen, so that if they have a very severe reaction where they have trouble breathing, their throat tightens up, that they would need to give themselves an epinephrine shot. So those are the folks that, at least it seems like from the United Kingdom experience, we're going to see. Now, we're still looking at certain populations of patients where, say, they may have a markedly immunocompromised system, where, let's say, my HIV patients who are not well controlled. We're still deciding, and we'll be looking to the FDA for guidance on that as to whether they should be getting the vaccines or not. But for the most part, unless you have a very severe anaphylactic reaction, you should be very safe for the vaccine.
Real quickly, Doctor, we're running out of time, but I think is an important question. What's your message to those who are a little bit hesitant about even taking the shot?
So it seems like this vaccine has moved through very quickly, and we have seen that vaccines have taken a long time in the past, but you have to look at the power and the energy that was put into developing this vaccine. The folks that were in the laboratory were not cutting corners, they were not doing anything more rapidly. The process that's been really shortened is in getting them the finances to do this, and then in getting the approval through the FDA. So the lab work really hasn't been shortened. Those scientists were doing everything that they would do with any other vaccine, providing just as much safety and innovation as they would for any other disease process. So it's been quick, but for a lot of reasons that don't have to do with the science of making a vaccine.
Well, that's important to know, to hear that you need that funding. That funding is clearly crucial. Dr. Kristen England joining us once again from the Cleveland Clinic. We appreciate you taking time out of your morning to speak with us and our viewers today.
Have a great and safe Friday.
Absolutely. You as well. Thank you.